Are you planning on getting pregnant within the next year? What is your waist size? Have you recently had problems with a coworker, supervisor, or a divorce? These are just a few of the rather personal questions that are asked of the Penn State faculty for the Penn State Take Care of Your Health program. Its purpose is to improve the health of Penn State's faculty and lower healthcare costs for the university. But what exactly does this program entail? Well, it is designed as a three-step process to improve the overall health in the Penn State community. The 3 steps ask faculty to complete a wellness profile, commit to completing the prevention exam certification, and submit to biometric screenings. Basically, they're asking them to fill out a medical information questionnaire and have a wellness checkup done by Penn State doctors or their own physician, which can be submitted for an extra fee.
While this program clearly has good intentions, many of the faculty have found issues with it.
Start with one and then the first question is, are you aware that female employees are required to disclose if they are planning to become pregnant in the next year? Is it appropriate that women who refuse to disclose their reproductive plans are fined $100 a month?
Privacy is a major concern for many of the program's participants, as it includes putting personal results from the questionnaire and screenings on WebMD. It was unclear just who exactly would have access to the employees' accounts that contained a complete profile of their personal health. Many of the faculty were concerned with a third party having their results because WebMD has been hacked in the past. When asked about these concerns, representatives of the plan recognized their concern but stated that Highmark Health Services is contracted with WebMD Health Services, which is only available for direct purchase by health plans and employer groups. In other words, they believe the site is very secure, but some are still skeptical. While these questions do deal with trying to improve one's health, some would prefer to keep this information between themselves and their private doctors. The plan originally contained a fine of $100 per month for not completing the 3 steps, and this created a serious uproar within the faculty. Many would have gladly participated in the first step of medical screenings but felt uncomfortable uploading their information. But this fine of $1,200 a year really coerces them into putting their information online, violating their medical confidentiality. The university claimed that by uploading the information, the staff member is giving consent, therefore it is not a violation. However, many staff feel as though they are really not given a choice, especially those who only make $20,000 a year, as a $1,200 fine is not really an option.
This highlights another concern with the program. It employs flat-rate fees to all faculty members for not complying or simply engaging in unhealthy behaviors such as smoking, which incurs a $75 fee. An anonymous faculty member raised concerns with this because he felt it would disproportionately affect the faculty members of different income levels. Low-income employees will seriously feel the effects of these fines, while high administrators have no real incentive to reform unhealthy behaviors. On the other side of this issue, the people who developed this program did not see merit in charging one person more than another for the same behavior. In response to the serious backlash, they eliminated the fine and replaced it with a one-time $100 reward for completing the program. This wasn't the original plan because an incentive program will result in an overall healthcare premium inflation, discounted for those who participated in the program, which the university did not feel was fiscally responsible. They also implemented a healthcare task force to further review other aspects of the initiative.
A major catalyst for the opposition to the program was the lack of communication between the administrators and the rest of the faculty. There was a lot of confusion with the rollout of the program. The staff felt they were not fully informed about its requirements and how it would impact the cost of their health care. As Dr. O'Hara stated, many of the faculty would have more easily accepted a flat rate increase of their premiums. Instead, many of them felt they were being tricked into paying more each year by the convoluted process they were being subjected to. One faculty member interviewed said that in the questionnaire they filled out, certain conditions were already checked, such as smoker, that would result in a fine. If a person wasn't paying attention or didn't notice, they would have had to pay the extra fee. On the other side, this program isn't solely intended to reduce healthcare costs. It is also to improve the overall health of Penn State employees in the long run. Imposing a flat rate fee would not have the same effect as monitoring certain health conditions. The university tried to remedy the communication problems by holding multiple question and answer sessions with faculty and faculty senate. In these meetings, they attempted to clarify questions about the program, its impact on the faculty, and what changes they made to it.
But what makes this issue a public controversy? Why should you care about a program that only appears to affect the staff of Penn State? Well, this program actually plays into the national conversation of healthcare reform.
But what's important for everybody to remember is not only that the law has already helped millions of people, but that there are millions more who stand to be helped. And we've got to make sure they know that.
Many people found similar issues with the recently enacted Affordable Care Act, mainly that the communication was confusing. On such sensitive topics, clear communication is key in gaining the trust and support of those who are affected. And when it is lacking, this breeds opposition and unease. Most people, to this day, do not understand the key elements of the Affordable Care Act and oppose it on completely unfounded terms. The Act attempts to raise the minimum standards of healthcare companies. It allows participants to keep their children on their programs until age 26. It bars companies from excluding coverage of pre-existing conditions. It mandates companies with over 50 employees to provide health care for their workers. The term Obamacare embodies all of the misperceptions about the Act. Although Obama did support the Act's creation, it was Congress which wrote the law, and this is not actually a health care plan. The original draft included a public health care option, but this was struck down. So, people's worries that the government forcing people to buy health care from the government are completely unfounded. While the two programs have different purposes, one attempting to lower the healthcare premiums at a public university and the other intending to raise healthcare standards, they both raised major public opposition, much of which could have been avoided with clear communication of their intentions. People are very protective of their private health information, and any changes to the health systems need to be handled tactfully.
While the content of the Take Care of Your Health initiative may be good and well-intended, the process is lacking. Because of the lack of communication and other policy issues, what otherwise might have been helpful programs are experiencing major backlash. After all of the uproar and outrage from Penn State faculty and staff, the Human Resources Board knew changes had to be made. But will a $100 incentive and review committee be able to neutralize this controversy? One esteemed professor didn't think so. Though he preferred to remain anonymous, this professor recognized that the controversy surrounding the program wasn't as much the money as it was the uncertainty surrounding where the data was going to be kept, who is going to have access to it, and what could be done with it in the future that might be harmful. And even though that uncertainty has been addressed, he thinks it left sort of a patina of uncertainty about everything that's going to take a lot more than a committee to fix. He believes that penalizing staff for not releasing personal information left loyal, hard-working faculty questioning the culture of Penn State and their security within it. They began to wonder, what's going to happen next? Is my pension on the line? As this professor said, that insecurity takes a while to heal, if it ever does. Those are some pretty deep cuts, and they're made deeper by the period of uncertainty that we're in here. We can only hope that people can clear their vision and see past these uncertainties to take hold of the possible benefits of these programs.